Welcome. Thank you for joining us for today's 211 Year Later celebration. We certainly hope that all of our viewers are tuned in, you're comfortable, you're prepared to enjoy an hour and a half of excellent information, data, and stories that show the true impact that 211 has had on our community in just 1 year. Due to the angst and uncertainty gripping our nation right now due to the COVID-19 pandemic, the services and resources provided by 211 have become that much more essential and invaluable to our neighbors here in Lake County. I was reflecting today as I was preparing for this celebration, and I was thinking I may have never met men by the name of Jerry, Michael, and Robert. Jerry, Michael, and Robert were three men who found themselves in difficult and precarious circumstances. They were homeless. Some say they felt hopeless, but through the services provided by 211, they were able to be connected to the Waukegan Township Eddie Washington Center, which I am fortunate to be the director of, and they've found transitional housing, which allowed them to reclaim their independence and get back self-sufficiency and get back on their feet. Had it not been for 211, I may have never met Jerry, Michael, and Robert. So we are here to celebrate the services for helping those men come out of a state of despair and uncertainty and now walk with pride and dignity due to the services that they were able to be connected to through 211. But we are not just here today to celebrate the assistance of helping men. We're celebrating all the connections 211 is making for our Lake County neighbors. Connections to food and domestic violence assistance, connections to utility bill assistance, connections to mortgage assistance, mental health and drug counseling. 211 provides a myriad of services, which many people here in Lake County have taken advantage of during this time. Once again, I am Marc Jones, and I am extremely happy and excited to be your host for this event. Just for a little context, I would like you all to know that in 2019, 95% of our nation had access to 211. The state of Illinois was actually last adopting the 211 program. And I would like to salute personally Christy Long, United Way, and the team and her team and board of directors for opening up 211 to Lake County, as we are now the largest county in the state of Illinois to have implemented 211. So we may be late to the party, but we're making a tremendous impact in just 1 year. So I invite you to sit back, relax, enjoy hearing about the tremendous impact 211 has already made and what the plans look like for the future. Today, you'll hear from an awesome team of people who've been making 211 happen. We'll learn about year one results, discuss them with a panel of Lake County Human Services experts, and of course, talk about the future. Oh, and we'll hear from the director of 211 Contact Center herself with a real life story of how 211 matters. So that's enough from me at this time. I'd like to take this opportunity now to let's begin with the core leadership team of 211 and the United Way. Carla, take it away.
Great, thank you, Mark. It's great to be here with all of you, and what a year. What a year for Lake County, for the country, and honestly, the world. And honestly, it's been a great year for 211. I don't think that 211 could have come to Lake County at a better time. We just launched a year ago, as Mark mentioned, on September 24th, 2019. We were thrilled with the number of calls and texts, knowing that the service was being so well received in its first 6 months, proving that the need we believed was out there truly was there. We were feeling great about the way 211 was addressing that need, the way the service was performing, and then suddenly COVID hit. And then you can imagine the giant pivot necessary. People who honestly never really thought they would need help were reaching out in droves. Our human services providers had to transform how they operated on a dime to deliver their desperately needed assistance under honestly the most challenging of circumstances. I mean, how do you provide shelter for victims of domestic violence who can't be in the same space as other victims because of a virus? Where do you house homeless people who can't be within 6 feet of each other? And how can you gather together to distribute food to the newly unemployed? How do you keep up the information in a 211 contact center? How do you keep it up to date and current when it's changing constantly with COVID as it invades our country? But it should be of no surprise that our 211 team rose to the occasion. I'm so proud of the work they did. A lot of preparation and responsiveness, and of course the work that the United Way of Lake County did to support and to continue to serve in the most difficult of times. Thank you for being here today to celebrate with us. It's been an amazing amount of work. We're very happy with what we've done and look forward to the future. And Irene, we're looking forward to hearing more from you next.
Great. Thanks, Carla. You're so right. It's been a remarkable first year for 211. And what that really means, it's been a remarkable year for making a difference in the lives of our neighbors all across Lake County. When we formed our very first advisory council early this year and started brainstorming about 211, what 211 could mean, we knew we wanted a program that could serve everyone in Lake County, wherever they found themselves needing help. After all, many of us need some kind of assistance at some point in our lives. Year one has borne out that reasoning. As you will see today, 211 has had contacts from every municipality in the county. Every zip code is represented, as is an amazing variety of demographics. While COVID has focused these requests into a few key categories, as you'll see in a minute, still every area of human services was requested during our first year. Overall, we are delighted to have had this strong first year of reaching so many people. Christy, we'll look to you to tell us who's been involved and how to keep this 211 train moving right along. Thank you.
Mute. It's exciting to hear how far-reaching 211 has already been, Irene. And part of that success came because of the generous funding received from many, many caring partners. From our largest contributors, such as Lake County government and the townships throughout Lake County, to local companies delivering on their corporate responsibility, to our small businesses and community service groups, right along with our philanthropic individual donors. It took everyone's time, talent, and yes, treasure. Now our community knows what 211 is, and now they can access the help they need. And people now have help and hope when times are tough. We can't thank our donors enough. You should know that your generosity has already made such a big difference in so many people's lives, and you're going to hear about some of those stories this morning. Meanwhile, I ask everyone to continue to support 211. We need to sustain it together. If you donate $211, you become part of the 211 Club. And if you come in as a sponsorship level, you will be recognized throughout 2021 again and again. I'm so grateful for your support and so glad you're here to celebrate with us this afternoon. Now I'm going to turn it over to Deanna and Julie to show us the data. Show us the great story, ladies.
Thanks, Christy. My name's Julie Gordon, and it's Deanna's and my pleasure to report on the results from our first year of operation of 211. We are committed to using data from 211 to inform decision-making, and we embrace a culture of continuous improvement by regularly assessing 211's impact. Let's go to the first slide of data and talk about some of those connections that Mark alluded to. How many connections we've had? Well, if we break it down, we've had 6,760 calls or texts coming into our contact center. Of those, about 78% have come in by phone, 22% by text, so a nice mix. We've also had 49,663 website sessions to our 211lakecounty.org website. So together we have made 56,000 plus connections in the community through 211 in our first year. If we go to the next slide, we'll see a breakdown of some of those calls and texts that I spoke about and how that's changed over the course of the year. When we launched back on September 24th of last year, we started somewhat smoothly with a pretty steady amount of calls and texts coming in each month. February took a little dip, and then all of a sudden COVID hit in March. We saw a 92% increase in calls and texts coming into the center in March. Tapered down a little bit, and then again, another huge hit in August, partly due to the fact that the federal unemployment subsidy ended in July, and also because the rent assistance funds began being promoted through 211. The call levels have remained high, and the data we have so far in October suggests that October will be on par with September. We've also seen that about 53% of the calls and texts coming in from March on have been related to COVID-19. If we go on to the next page, we can look at a breakdown of website sessions. The pattern here has actually been a bit different. We saw the peaks in March and April, partly as a result of adding some volunteer and donation information to the website, but largely as a result of having more COVID-related resources available on the website when people needed them. Let's take a look on the next slide at when those calls come in. As we look, 211 is available 24 hours a day, 7 days a week, which is very valuable to the individuals who need the resource. During the week, we do see higher volume, but we do see 12% on Sunday and Saturday. If you look at the pie chart, this is the time of day for weekdays. And you could see that while 79% come in during regular business hours, about 24% of the weekday calls come in after 5 p.m. and before 8 a.m. So altogether, we're very pleased that we're able to be a resource to all of the callers who need help outside of regular business hours. And that's about 31% of the contacts that we've had. The average wait time over the course of the year has been 2 minutes and 42 seconds. That has fluctuated quite a bit. It was actually lowest when we started, but with COVID and the huge peak, the huge increase in calls and texts and the impact on our call center, we've seen wait times vary quite a bit and being frankly higher than what we'd like them to be. That's an area that we're working hard to reduce. I'm going to turn it over to Deanna to talk about how people hear about 211.
There are so many different ways that people hear about 211. We're very pleased to see that agencies, our nonprofit providers, different service providers all throughout the county are a top referral for people to 211. The other big thing that we're excited to see as well is that many friends and family members are recommending 211 to loved ones as a resource for them to meet their needs. And over the course of the year, we've seen a growing referral rate from government and first responders, churches. That's an area where more and more agencies are providing referrals to individuals, and those individuals are getting connected. So excellent to see. We need everyone to keep it up so we can continue to make sure we're reaching people to get those needs addressed right away before they get worse. Let's look at the next slide to look at communities connecting to 211. Over the first year, we saw calls, texts from every single zip code in Lake County. However, when we look at the top 10, we see that Waukegan is a majority of those calls each and every month. When we look at the average for the year, we're at about 33% of calls and texts coming from Waukegan. Our next biggest community is Zion at 9% of the calls and texts, and Round Lake at 8%. Let's look at that next slide to see what that age and gender breakout looks like for people. So overall, a majority of our callers are between 18 and 54 years of age, but we do have about 25% of callers that are in the senior age range of 55 and plus. A majority of our callers are women, but it was interesting for us to note that we had a few calls from people that identified as gender nonconforming and trans male. So we will be doing some more outreach to the LGBTQ community in the next year because we feel like there's probably a larger percentage of our community that identifies in that other bucket. Let's look at race and ethnicity next. overall, I just want to note that race and ethnicity is an area where we have less data. Many times when we ask about race and ethnicity in the context of a call or text, this is an area that someone refuses or isn't sure how to answer. So of what was reported, we have about 62% of people indicating that they are white, 34% Black. Those are our majority groups. And for ethnicity, we have about 33% of people indicating that they are Hispanic or Latino. It was interesting when we looked at the data that from April and June, we had a much higher proportion of individuals noting that they were Hispanic or Latino. Let's look at the next slide for income. The primary source of income is something that we ask about because it can help us lead to understanding other referral options for people or where there might be some barriers when we're referring to agencies. Overall, about 33% of individuals reported that they were employed, which really speaks to the needs of those that are working hard but still struggling to survive. It was also interesting to note that about 28% had no income at all that they reported. Next slide. Of course, COVID-19 has rocked our world this year, and one of the most apparent ways that we saw that in the contact center was looking at the trends in employment and unemployment overall. So note the percent rise beginning in May for calls and texts reporting their primary source of income as no income or unemployment. We had a peak of 46% then. And then we also saw a pretty significant rise in unemployment numbers that started in March and then increased significantly in June. Next slide. I'm going to turn it over to Julie to talk about some of those needs requested from all those callers and texters.
Thanks, Dana. So far we've talked about people calling in or texting in to the contact center. Oftentimes when they call, they're calling with one need, but then as our specialist talks to them, other needs are identified. Sometimes they call in with multiple needs. On average, there are almost 2 needs for every call or text that comes in. So our specialists are working with the caller to identify those needs and provide requests and provide referrals. If you look at the trend line of both the calls and texts, which we talked about before, which are the blue line on this chart, you could see that the number of need requests follow the same general pattern, but there's actually an uptick in July and August of the percentage of need requests per call that comes in. We actually saw callers having more needs during those time periods. Next slide. This slide has a lot of data, so let me spend a couple minutes just explaining what's here. So for those 12,241 needs that were identified over the course of the past year, they break down into generally 13 categories. And I'm just going to spend a couple minutes walking through this, and then Deanna will get into a little more detail on a couple of these categories. Every month, the category with the highest number of needs has consistently been housing and shelter. The next few categories shift around a bit, but utilities, food, mental health, and healthcare are always at the top in varying orders. You'll see the 4th category down is other. Those are just needs that come in that don't fall into these other buckets. That might include things like general information and referral services, or questions about donations or volunteerism or animal control, or a whole host of miscellaneous items. Let me now take your attention to a couple other categories. The utilities, if we look at that, the primary categories are electricity, which is the majority of the calls that come into the utilities as a utilities need, and then gas. Food has been interesting. It's always a top need, but we saw a 4-fold increase in the need for food requests going from February before COVID to the first month of COVID in March. So that's been clearly a need in the community with COVID that has increased. As you look at each bar, you'll see that part of the bar is blue, Those are situations where the need was met by the specialist with a specific referral that was made to them that they could then follow up on. The orange part of the bar is where no referral was made. And there's a whole host of reasons why no referral might be made. It could be that there was no service available. It could be that there was just no service found as the specialists have gotten more familiar with the services in Lake County. Could be that the individual wasn't eligible for a service, or they weren't even asking for a specific service. So a whole host of reasons. Over the course of the year, about 3/4 of the need requests were met with referrals being made. But I'm pleased to report that over the past quarter, we've actually increased that from 73% up to 85% of situations where referrals are made. Next slide.
We're going to dig a little bit deeper into housing needs since it is our #1 category month after month. When we look at this particular category, there's some consistent things that pop up each month. Rent payment, homeless shelter, low-income housing, mortgage payment, and transitional shelter. Throughout the entire year, these have been really big needs that are being requested to 211. But it's important to note that COVID-19 made all of these needs much worse, and we had a much higher rate of request for each of these, particularly when we look at the rent payment assistance need being requested, which you can see that significant jump on the chart on the right. Over the last couple of months, we have partnered with Lake County government, which has created a wonderful program called the COVID Housing Relief Program. And that program has worked to increase the amount of funding available for rent assistance in Lake County and put that funding through different providers in the community. 211 was selected to act as a centralizing resource to allow people to call or text in to seek assistance from that, and then to streamline the application process for that individual as well as that agency. Since we began taking CHIRP calls in August, we have screened over 552 contacts, and we have had 529 contacts that have been connected to a CHIRP provider. It's important to note that CHIRP also assists with utilities, which is our second highest need that's requested each month to 211. Let's look at mental health and addictions now. During the COVID-19 pandemic, we know that there's been an increased need for emotional support, as well as increased levels of suicidality and substance abuse, unfortunately. 211 provides an easy to remember number for anyone in Lake County to call if they're feeling really overwhelmed and just looking for that next step or resources that might be able to assist them. Overall, mental health and addictions is our 4th highest category of need if we exclude the other, which contains a lot of miscellaneous things. So very highly requested. And in that, you can see that mental health services are the #1 area that's requested. We also have high rates of substance abuse and crisis intervention that are requested, along with a few other things. But please remember that if you're feeling overwhelmed or know someone that is, 211 can be that first step to finding that service and support that you need at this moment. So please don't hesitate to call us. I'm going to turn it back over to Julie to talk about the impact on the Latino and Black community.
Thanks, Deanna. Deanna previously reported about these groups as a proportion of the total. And again, we don't get data on all of the callers as to their ethnicity or race. But for those that did identify an ethnicity, if you remember, 33% identified as Hispanic or Latino. So this chart compares their results on the left to all groups. And what you can see is that for this ethnicity, housing and shelter actually came in below the average across the whole group, with almost all of the other categories being higher than average. If you look proportionately, the highest trend for Hispanics and Latinos relative to all groups is in the government and legal category. The communities you could see on the right, top ones being Waukegan, Round Lake, Zion, Mundelein, North Chicago. Let's go to the next slide to look at the highlights on the Black community. And again, for those that identified race, about 34% identified as Black. And for this group, housing and shelter actually was more than the average. By far, that seemed to be the category with the most need, with most of the other categories being below average. Top communities for this race were Waukegan, Zion, North Chicago, Gurnee, and Round Lake. Deanna?
So if we can switch to the next slide, we'll talk a little bit about what contacts say about 211. So over the course of the year, our goal is to reach out to a number of individuals that connect with 211 and to understand how satisfied they were with the service and whether or not their needs were met. This past year, we were able to reach out to 2% of our contacts. Next year, we're hoping to increase the number of people that we're able to reach out to. But our results from last year are really great so far. We're really pleased to hear that 99% of individuals that completed a follow-up indicated our 211 staff are polite and professional. We had one person that said no, and of course we would love to change that to make sure we're getting 100%. So that's something that we're working to improve. We had 92% of people that would recommend to friends and family. Again, really pleased with that. And I think that's proven by looking at how people are connecting with 211 and seeing friends and family as the #2 way that people are connecting and hearing about 211. So keep up the work as you pass out information to friends and family. On the outcome side, 84% of individuals that had contacted 211 and completed a follow-up received the information they needed to connect to a health and human service provider. And really exciting for us is that 68% learned about a new resource. So that really just shows that there are so many resources out there in Lake County. We're rich with health and human services in many ways. And it's hard to navigate that. And one of the reasons we wanted to bring 211 to Lake County was to help people untangle that web. And really pleased again to see 68% of people learning about a new resource that was able to meet their need and maybe they had never known about before. I'm going to turn it over to Mark now. Thanks, everyone.
Thank you, Deanna and Julie. Okay, thank you, Deanna and Julie. Some of those numbers are truly staggering. As we are fortunate to be joined by a panel of human service experts right here in Lake County, we'll be able to take a deeper dive into some of those numbers, some of those statistics from people who are dealing with that specific clientele on a daily basis, as they provide a unique perspective for our viewers on how 211 directly connects their organizations to the people that need the services the most. And also, I'd just like to take a moment just to kind of just make a point to say that it's interesting that I believe it was Deanna who illustrated that, who pointed out that every zip code within Lake County has used 211. So similar to how 911 knows no boundary when we need emergency services from police, fire, and paramedic, there is no zip code, within Lake County that is immune to mental health needs, housing needs, addiction needs. It goes across the spectrum, and there's all areas of Lake County that have needed that services and have benefited from that. So that just goes to show the far-reaching effect and impact of 211 in just 1 year. So now I'd like to take the opportunity to introduce our panel of esteemed human services experts. We have Ms. Brenda O'Connell, who is the Acting Development Administrator for Lake County Government. Mr. DeMar Harris, Director of Programs and EEO Officer for Lake County Workforce Development. We have Ms. Dulce Ortiz, Executive Director of Mano & Mano. Mr. Sam Johnson Murillo, Director of Behavioral Health for Lake County Health Department, and Ms. Carmen Patlan, Director of Highwood Public Library. Welcome to the panel. How's everyone doing?
Good.
Good, thank you.
Good, thank you, Mark.
Okay,
Good,
thank you. So again, we heard we heard all the data behind 211 and how it's impacting lives. But now is an opportunity for you all as our panelists to kind of dig a little bit deeper, unpack those numbers a little bit, and tell us from your unique perspective what that data actually means. Also, it's important for me to mention that during this panel conversation, we're also going to see two stories from families and people who are actually helped in a tremendous way by 211. So it's always great to know the numbers and the data, but to put a human spin on it, to give it that human touch that we need to know those people that are really being affected. I think it gives it so much more substantial feeling and meaning to what 211 actually means. So that said, I think I've set the context. I'd like to start with a general question for the entire panel. And we'll start with you, Mr. Harris, and work our way down the box here, okay? So what is one really positive outcome related to 211 that you have experienced or observed in your respective fields thus far? One really positive outcome, Mr. Harris?
Thank you, Mark. One positive outcome I can say is that 211 now offers a one-stop shop for job seekers and residents here in Lake County, where it provides valuable resources and services to our residents. Another is that we are now seeing the private sector now add 211 within their HR portfolio as they onboard new job seekers. And so not only is the private sector addressing the general health benefits and the general benefits that come with the new applicant securing a new job, but 211 is now embedded within their onboarding portfolio. And to me, that is a prime benefit, knowing that they're looking at addressing additional barriers outside of the traditional employment requests.
Good. All right. Thank you, Mr. Harris. Mr. Morello?
Thank you, Mark. You know, we knew that 211 was going to be a big benefit to the people that we work with, behavioral health and physical health. But I think we were pleased and surprised to find out how often our staff would use it, whether they're in the field working with someone and a need comes up and they need to know how to help them, or even in the office, you know, a therapist in a session might pick up the phone and call 211 right there with the person to find help for them. So it's been a great resource for staff and clients both.
That is an interesting note there, Sam. Ms. O'Connell.
Thank you. Was it Carmen or Brenda?
Brenda. We'll go to Brenda. We'll get to you, Carmen. Thank you.
I was really pleased in this last year to see how valuable the 211 information was being used in the community. I think as the coronavirus pandemic hit, we were all eager to try and figure out, how is this impacting people in the community? How can we sort of launch a community response? And I was able to point out the 211 Counts website to municipal leaders and nonprofit organizations who were able to incorporate that information as they were making decisions about how to change their services and how to do outreach differently and how to think about things differently. You can see overnight the data from the call center is displayed on this website in maps, and you can see by zip code what are the requests and what's happening. And when we all needed to respond to the crisis, it was really valuable to have that information and be able to look at it essentially in real time.
Thank you, Brenda, for that. Ms. Ortiz, what can you tell us about mano a mano and the real impact 211 is having?
Well, first of all, Mark, I just want to thank United Way for putting this on and for inviting me to be on a panel of these amazing colleagues and very hard workers in our community. So I'm very grateful to be here. For us at Mano a Mano, language access is extremely important. And we knew that this was a priority from the get-go. United Way and the call center were dedicated to making sure that this was incorporated from the beginning in a very meaningful and intentional way. And it wasn't just an afterthought. When you call and communicate in your own language, people develop a trust, which is extremely important to have someone at the other end of the line understand the linguistic, cultural, and social barriers to accessing services. Again, this is so important in the development of the trust to continue utilizing 211 as a trusted resource. Another positive outcome that I can say has made a huge impact is that in this past 4 years, our immigrant community has gone through a lot, and people are afraid. They're afraid to seek resources. They're afraid to utilize resources. And so being able to call 211 and not have to give too much information in order to access the services has been a great relief to them.
Awesome. Thank you very much, Ms. Ortiz. Now, Ms. Carmen Padlan, what is a one really positive outcome you can share with us about 211?
Thank you, Mark. So it's a pleasure to be here. As library staff members, we often get asked questions, every question under the sun. And so as librarians, there's always an answer to the questions as it relates to books and library resources. But as it relates to social services, not many librarians are very well informed of all the social services that surround this county. And so having the ability to have a resource like the United Way 211 at hand and readily available, we don't have to turn patrons away empty-handed. And as a library, I love storytelling. And so I want to share a quick story with you. Last week, there was and if for those of you that are familiar with Highwood, you understand the demographic we work with. And so last week, we had a single mom that came to the library and she asked me for help because she had lost her employment. She had had to move away from Highwood, and she was at a loss because she no longer could afford her apartment. She started to rattle off all the different barriers that she was facing, including food insecurity and some previous trauma that she had experienced. And so I reached out and I handed her an insert with the United Way 211 information. And I said, here is a lifeline for you. Reach out, just dial 211 and you're going to get connected to someone that speaks your language and you can ask for support. I saw her sit at a table and pondered over this insert. I approached her again and she looked up at me with tears in her eyes and said, is this like calling 911? Is this going to connect me to the police? And so I go back to what Dulce Ortiz just shared. Families live in constant fear. And so I reassured her that no, the United Way is not connected to the police. You can call with ease and you don't have to be afraid. And so our job as a library has been to thankfully utilize the United Way 211 resources to connect, educate, and bridge families to address barriers they're currently facing.
Thank you, Carmen. That's a great story. Thank you for sharing that with the panel and our viewers, over 200 viewers. So I'm sure that's valuable. Now I'd like to pivot to specific questions for you all. So Brenda, I'd like to begin with you. As Deanna and Julie stated while sharing their data, housing and shelter represent one of the most significant needs in our community at this moment. My question is twofold. Why exactly has this need grown during the pandemic? And what resources do we have here in Lake County to respond to those needs? And how are they connected directly to 211? And just for a backdrop to that, on a national level, we know that 28 to 39 million people are at risk of eviction by the end of the year. Landlords had a relief period that is now quickly approaching and coming to an end. So with that in mind, back to my question. What in Lake County, what can we provide? How can 211 help?
Thank you, Mark. I'm so glad to be here and have a chance to talk about housing. Housing is such an important need in Lake County. People having safe and stable and affordable places to live sort of really serves an anchor to so many other outcomes, good mental health outcomes, good school outcomes, good employment outcomes. Having an anchor that is your home allows you to accomplish so many other things. And right now we're just seeing record instability in the county. Before the pandemic, we saw that 22.5% of renters were severely rent burdened, meaning they were paying more than 50% of their income in rent, leaving little left to pay for other basic needs. In Lake County, someone would need to make $23.31 an hour to afford a 2-bedroom apartment at fair market rent. That's not an easy job to find. So we also, I feel, need to acknowledge the data that Deanna sort of brought forth, that these burdens aren't shared equitably across all races and ethnicities. And in Lake County, it's true that while in Lake County, 6.35% of the population is Black, when you look at the population living in poverty, it's now 12.4%, so double the proportion. And when you look at people experiencing homelessness, 43% of those experiencing homelessness are Black. So we know that this is a burden that's not shared equally across the county, and that's an issue we need to continue to look at and strategically act on. That's the data before COVID. COVID turned the world upside down and disrupted so many incomes. If you think about, you were already spending 50% of your income on rent, and then you had to stay home with a child, you had your hours reduced, you became ill and missed work for a period of time. We know that this, when we were looking at the data early on, I lost a lot of sleep thinking about how are we going to reach this population? How are we going to scale up these resources to meet this unprecedented need? How are we going to connect with our partners to make these resources available across the county? And what about those folks who have never had to reach out before? How are they going to know where to go? How are they going to know that someone on the other line will be able to speak the language that they feel most comfortable communicating in? I mean, I didn't create coronavirus, but this is the 211 scenario, right? 211 is the best way to talk about, do you need help with your rent? Call 211. Someone's there 24/7. They're going to be able to get you access to someone who can speak your language. They're going to be able to get you to these to resources. So when we launched the COVID Housing Relief Program, CHIRP, which Deanna spoke about a little bit, we integrated that with 211. You can call 211, you can get your initial screening done that way. That was a way to lessen the burden of our community partners, to quickly get information out, and to help direct people to the partner that's going to make the most sense.
So,
yes.
I'm sorry. Yeah, Brenda, let me just jump in really quick then. But so for anyone watching who may have a themselves, friend, family, relative,
Yeah.
What services specifically from Lake County do you think they can access if they're feeling that strain that can help them?
So the county's program, we partnered with, I believe it's 17 community partners. So in our department, we are funding the program and providing support to the community partners. But Mano a Mano is one of our partners administering rental assistance, and there are many more. Townships, Waukegan Township is a partner as well. So those services include up to 6 months of rental support, assistance with utilities, and potentially getting referred to other services, help with other subsidies, rental support. Using the 211 infrastructure, people can be referred to the job center and other resources.
Okay.
So far with the CHIRP program, we've served 369 households, which is far more than we were able to serve all of last year.
That's awesome, Brendan. Now, finally, I would ask, is there a phone number or website that you can share? Now, of course, 211 is the primary phone number we want everyone to use, but is there also perhaps a website or something someone may access to?
So we have the program manual and a flyer up on our CHIRP website. I'll drop the link in the chat box for anyone who's looking for that. Erin already put the Lake County Forward website there. There's a video there where people can learn more about the program. That's in the chat box. And of course, call 211.
Of course, call 211. Thank you very much, Brenda. I appreciate your feedback on that. Now I'd like to shift to you, Mr. Harris. You are in leadership with Lake County Workforce Development, and it would go without saying that massive job loss will go hand in hand with the rental strain. Correct? If you can't work, you can't pay your rent. So from your perspective, we know massive job loss has been a huge challenge of the COVID-19 pandemic, with record numbers of people filing for unemployment. If we take a macro view on a national level, 6.2 million were unemployed in February. That number rose to 20 million unemployed by June, and that's on a national level. That is truly staggering. So you, in leadership with Lake County Workforce Development, what are those unemployment statistics specifically here in Lake County, and how has Lake County Workforce Development collaborated with 211, and how has that served an important resource to help alleviate some of that burden on people?
Thank you, Mark. You're correct. Lake County has been we have been impacted by the mass layoffs here in Lake County. And if we were to go over some of the statistics here today, in Lake County right now, the unemployment rate is at 7.2% here in Lake County. If we were to compare it to other municipalities and cities, North Chicago's at 10.1%, Round Lake unemployment rate's around 8.7%. Here in Waukegan, the unemployment rate is 8.9%. And then when you look at the other Western corridor cities, such as Highland Park, they're around at 6.4%. And one thing I want to state is that Lake County is a very rich community. We have over 335,000 individuals currently employed here in Lake County. The median average wage for an individual, once they receive access for employment or being able to train up their current skill sets, the average weekly wage is around $1,600 a week. We have a very rich community here. What do we need to do? What has workforce development done? We understand that there is inequitableness as it pertains to wages earned and salaries given. And so what we have done here at Workforce Development is to make sure that we provide intentional programming within the underserved communities. How do we work with the high schools to create junior and senior employment and training programs and internships? How do we work with the local municipalities and their business developers to really get a pulse of the community and understand who is being affected by layoffs, who are the families and the children that are having limited access to tuition assistance and Pell Grants? And so what Workforce Development has done, along with our Workforce Development Board, we have now created an equitable task force, an equity task force, to make sure that everything that we're doing each day is intentional towards the underserved community. And again, providing access to all of the residents and all of the job seekers here in Lake County so they can make that $1,700 a week. And so it is something that we have continued to work on each day and strive towards.
That's awesome. That's great, Mr. Harris. And it seems like you guys have a real perspective of the actual areas of need, and you're directing your services to that area. So it's very fortunate to hear that. So just for clarity, if I'm unemployed or I need, assistance finding employment, resume training, anything of that nature, I can contact 211, be linked to Workforce Development, and you all can help me with that.
That is correct. That is correct. And if I could just give one example, this is one thing that has really hit home from the workforce development is having a scenario where there was a job seeker that was referred to workforce development to receive employment services. Upon that referral, we were also able to refer them to housing assistance through 211, where they were able to then receive housing. And from that point, Workforce Development has understood that 211 is not just a number, it is truly a foundational structure that is providing equitable access. So yes, anyone that is looking for employment services or tuition assistance should go to the jobcenteroflakecounty.com to start receiving services immediately.
Thank you, Mr. Harris, and thank you, Brenda DeMar, for giving us that real look inside within respective areas of expertise on how 211 is truly changing lives and can change more in the future. Before we proceed with our panel, we'd like to take a moment here. We've seen the data-driven results of 211, but we thought it was important for the viewers to hear a real story, a real testimony of how a life was impacted by the utilization of 211. So we invite you now to watch a recent story of a caller to 211 and how this family was guided to resources that helped.
I don't know where to turn. I lost my job because of the pandemic. I had to sell my car to pay my bills. Now the money is gone. I'm diabetic, but I stopped taking my insulin like I should have because I can't afford it. Now I've landed in the hospital. I'm a single mother with 2 children. We need so much. I'm so overwhelmed. Can you help?
I understand this is a very difficult time for you, and you've come to the right place for help. We can find a variety of resources to help meet your needs, and you don't need to search for them on your own. I can guide you to them.
That's what I'm hoping for.
It looks like your best option for financial assistance is Catholic Charities Emergency Assistance Program. We'll also refer you to the Family Self-Sufficiency Program, where single parents can get support coordinated by a case manager. I'd also suggest the Behavioral Health Program, where you can get counseling over the phone to help you deal with all that you're going through.
I never knew all the services were available to me, and I sure didn't know where to start looking for them. I really appreciate being able to call just one number for all my needs and speak to someone who understands me. I think I'm feeling better now.
Okay, thank you. I hope that everyone enjoyed that short video clip of how 211 can actually help provide services you may need in real time. Proceeding on with the panel, this next question here is for Ms. Dulce Ortiz. Ms. Ortiz, we know Mano a Mano's mission is to empower families to become full participants in the community. We are seeing that immigrants have been among the hardest hit by the pandemic. My question for you is actually threefold. Okay, you ready? Okay. Can you tell us specifically why that is? Also, what are the most urgent needs of immigrant families in Lake County right now? And finally, how has 211's bilingual navigators and language interpreter services been helpful connecting immigrant families to these valuable resources?
Yes, thank you, Mark. One of the things that I do want to mention is that even before this pandemic started, we were already dealing with structural and systematic inequities. And COVID-19 just pretty much exacerbated all of these inequities that we were dealing with. You're absolutely right. Our community members have been among the most affected in this pandemic. Unfortunately, 26% of Latinos in Lake County do not have health insurance. Some can't afford it. Some can't get it through Medicaid. Others are just uninsurable because of their immigration status. And others are non-US citizens, and they're afraid to take advantage of public benefits because of the public charge rule by the current administration. So in addition to that, we then have the disproportionate health impact on Latinos due to social determinants of health. That includes, lower formal education. They're more likely to be in poverty and have low income, language and cultural barriers. In addition to that, the economic impacts are harsher as well because Latino families typically have less savings and lower wealth to rely on in a time of crisis. Many of our families, because of the types of jobs that they have, which could be, temporary work, or they work on a cash basis, they don't have paid sick leave or disability benefits. In addition to that, Damar mentioned that, here in Lake County, the median wage, it's about $1,600 per week. What we've been seeing in our emergency fund program and those applications, our community members are only making, an average of $2,000 a month. And so we can look at those, wage inequalities that he was referring to. And so when we talk about the most urgent needs of immigrant families in Lake County right now, it's sad to say, but we're not out of the woods yet. We know our community members will continue to need support to meet their basic needs. As everyone here has seen, we're entering into the second wave of COVID-19 infections, and the state is starting to do mitigation efforts in different regions, which will close businesses, which will affect employment. And our goal at Mano a Mano is to continue our community emergency fund. We call it our Tanda program. And get direct economic assistance to our community members in need. Our Tanda program is focused on undocumented-led immigrant families in McHenry County that were impacted by COVID-19. And we set up a low barrier process that focuses on getting direct cash assistance to those in need, and also leveraging, the other resources that are out there in the community. And this is where 211, becomes part of our structure in the referral process. Our focus in this program is, to provide food stability, assistance with prescription drugs, and also assistance with DACA renewals. We also worked with immigrant-owned stores to establish a gift card program so that our community members could purchase cultural relevant foods. We established a delivery system by hiring community members to deliver this cash assistance directly. And we have been, very grateful to have raised more than $500,000 to support 1,300 undocumented led families in Lake and McHenry County, which translates, to about 4,200 individual community members. So again, the basic needs are still going to be, something that our community members are going to need help with. Most important, we need the state and the federal government to continue this type of assistance, as Brenda was mentioning, with the CHIRP program. We obviously don't want families to become homeless. We obviously don't want families to have their utilities cut off during the cold winter months. And so those basic necessities, are pretty much in general terms, for all those that have been impacted by this pandemic. But I think when you talk about immigrant families, they've been through so much. There's a lot of fear to utilize the resources out there. And so as an organization, we're grateful to be trusted and provide those resources to our community members. In regards to the third question, as I mentioned earlier, 211 bilingual navigators and the language interpreter services are very helpful, again, to have someone that understands, the linguistic, cultural, and social barriers to accessing services, and also to create that type of trust that's of utmost importance for our community members, so that they can always know they can rely on 211 whenever they're in need. And as an organization, we're very proud to be part of it.
That was such a thorough and comprehensive answer. I literally have no follow-up. Excellent. Well, but so thank you for the resources that you're providing to the immigrant community. It's truly invaluable. And that 211 collaboration is a huge part of that. The next question is for you, Mr. Sam Johnson Murillo. And this is a very, very important question, because through the pandemic, we've definitely seen reported increases in domestic violence, alcoholism, depression, and the list goes on and on. So my question for you would be, since the pandemic has created such an increase in the amount of stress and sometimes even trauma for community members who face job losses, illnesses, deaths, and things of that nature, and I do like throwing in my data when I can, we've had a 6.5, in 2019, 6.5% of people in our nation reported depressive disorders. As of the end of August of 2020, that number's literally tripled to 25% of people have reported depressive disorders with just in that period of the pandemic. So my question to you, sir, would be, can you talk about the toll the pandemic has taken on our mental health overall? How has the county responded to this extra stress and strain that they're experiencing from people dealing with these mental health issues? And how can individuals struggling with mental health get help from Lake County Health Department by using 211?
Thank you, Mark, and I appreciate you quoting some of those stats. I'm getting a little bit of feedback. Can you guys hear me okay? I just want to make sure. Yeah. Great, thank you. Part of the question was, what has been the impact? And the truth is, we won't know the impact of this, the complete impact, for a long time. There tends to be a delayed response for a lot of trauma survivors. So I think we're going to see the impact of COVID for a long time. But what we do know so far is in Lake County, suicides and fatal overdoses are both up this year. We're on track to have more suicides this year than in any year of the previous 10. And that's just as far back as I had the data. So, we know some of the things that contribute to suicide are social isolation, financial stress, and feelings of hopelessness. And of course, those are three things that are just everywhere right now with COVID and what we've heard the other speakers saying. And the opioid overdoses was a big problem before COVID. We had the past few years have seen increasing numbers, and even the first few months of this year before COVID had seen an increase. But even since then, we're seeing our highest numbers this year than any of our previous years. And some of that is due to the availability of substances, or maybe the potency, like fentanyl, which is a powerful synthetic opioid. So we can't just necessarily blame it on COVID, but we know there's been a correlation between COVID shutdown and the increase in fatal overdoses. So, but it's not just people who have a pre-existing mental health condition or substance abuse issue. You know, as you mentioned, a lot of people are reporting issues with depression and anxiety and social isolation. I think a lot of people are finding themselves drinking more or using substances more. They may have increased stress or more time on their hands. People being out of work or working, but working from home, and you're trying to do childcare in the room next door. All of that just adds up, and people's normal support structures are just not there like they usually are. Here at the health department, at a time when you think there would be more people reaching out, we actually saw a decrease in referrals for child mental health. And a lot of that is because a lot of our referrals come from the schools, and with the schools not being in session in person, those teachers and social workers were not making the referrals to treatment like they normally would. So our fear is that there's a lot of untreated issues out there right now. And we hope that those will come to light later and people will start getting help. We have seen somewhat of an increase now that the school year is back in session, but not like we usually do. So, but the health department and most providers in Lake County have pivoted to using a telehealth model where people can see a therapist or psychiatrist over their computer, just like we're doing the session, or even over the phone. And that has actually increased availability more than ever before. So even at a time when a lot of businesses are closed or closing or have limited hours or limited availability, behavioral health is actually more available now than ever. So even 12-step groups are meeting online. So we're very pleased about our ability to provide services, and it's just amazing what we can do now with technology. So I think there's actually more accessibility now than there ever was before. People don't even have to leave their homes to get treatment, and 211 has just been a great way for people to access that, because as we all know, there's a lot of help available, but finding that help is very difficult in the insurance situation and all that. So it's so great to just be able to tell someone they can call 211 and find out a service that works for them.
So just for clarity, if someone is feeling suicidal or depressed, or they may want to hurt themselves or others, they can contact 211 and speak to a therapist or someone trained to give them services to maybe get them to make a better choice?
Yes, they certainly can call 211, and 211 will often, depending on the severity of the case, would then refer them to maybe our crisis line or another crisis line for more intensive follow-up.
Okay, fantastic. And just with me working with the homeless population, I can also say that so many of them also have undiagnosed mental illness. And I would say that, mental illness just in our country reverberates through so many different levels, and it causes a lot of other issues with substance abuse and self-medicating and things like that. So the services you provide there at the Lake County Health Department and that collaboration with 211 are truly invaluable and a necessary resource. So thank you for that answer, Mr. Morello. Before we proceed with our next question, again, we'd like to take a moment for a quick video interlude to take another look at a recent situation and how 211 helped make a tragic situation a little easier.
I really need help. My sister died suddenly, and she's left behind a husband and 4 young kids. We're all so upset and sad.
I'm so very sorry for your loss, but you're not alone. We're here to help you.
We don't have money for the funeral. My brother-in-law has to work full-time, and I'm going to have to care for the kids. I've never been a parent.
That's a lot for anyone to handle. Let's look for funeral expense assistance right now. And so I don't keep you too long today, I'll also see what other resources are available to help you. Okay, we have 4 resources available for funeral expense support. There's also grief counseling services for you and your family, and parenting classes for you.
Thank you. But it's the funeral costs I'm really worried about. Plus the mortgage and utilities, because we've lost one whole income.
I understand. We'll focus on that now And then you can follow up with me on the others when you're ready.
The funeral was last Monday. We got expenses covered. We'll be receiving housing and food assistance. And the kids and I start counseling next week.
Oh, that's so good to hear. So are we ready to talk about parenting classes?
Wow, that's a very real story. And if you've ever been in a position where you had a loved one pass unexpectedly and they not have any insurance or any type of savings, funeral expenses are extremely costly. So 211, even providing that funeral burial assistance is truly invaluable. That said, Carmen, I have a question for you. Okay, Ms. Potline, you have long been an advocate for immigrant families across Lake County. How does your new role as the executive director of the Highwood Public Library help you in that advocacy? And what part does 211 play in helping you connect Highwood families to resources that they need?
Thank you, Mark. So I'm sure every single one of you here has heard about Highwood and all the restaurants and great fun Highwood has. And, you know, the huge Pumpkin Fest and now the skeletons all over. If you haven't come and swing by and check out all the skeletons around. So Highwood is known as this fun place, but the underbelly of Highwood is countless immigrants who live here, who try to go unseemingly throughout their day. And so I've worked in the nonprofit field for over 15 years, mainly focusing work with immigrant families, but never had I worked in a community similar to this. Highwood is an island in the middle of the North Shore, surrounded by extreme wealth, with the perception that it has no needs, but that is far from the truth. So for the past 18 months, I've really gotten to know the countless families. In the first 10 months that I was here, we increased the library footprint by 21% and our programming by over 400%. And the community started to build and establish trust with this library, which is a very important aspect for those of us that work with immigrants to build and establish trust with families. But over the last 7 months, due to COVID, the Highwood Public Library has continued to remain this positive anchor for this community. Despite our doors being closed for several months, we were able to continue serving library patrons by providing them access to now virtual programming. And so we have completely turned our services into virtual resources so that we wouldn't lose the energy and the excitement families had to accessing services. So our thought is that if we educate families, we increase their literacy, we're able to help them break cycles of poverty, and it's generational cycles of poverty. So by providing them access to GED classes, ESL classes, computer classes, and services for their young children, we are helping them to advance and bridge that gap to literacy. So for example, 2 weeks ago, we graduated our first 4 students with their GED. 3 of them are now registered for community college. These individuals will be able to break that cycle of poverty and understand the value that academic success has for the future of their children. And so now I think that all of you, I think Mark, you opened up by saying how much you value the teachers for the kids. Well, this community is genuinely struggling with getting their children connected to that academic path, because prior to COVID, these kids were also in survival mode. If parent is in survival mode, so is child. And so there's countless kids that were failing prior to COVID in their schooling. And now due to COVID, it's even worse because they don't know how to download Zoom. They don't have the digital knowledge, nor do the parents, because parents are working 2 or 3 jobs. And many of the parents that live and work here literally work around the corner. So as you know, the Highwood is a restaurant industry, and countless families, both breadwinners, work in the restaurant industry. And when COVID hit, these restaurants had to shut down. And that meant that these families lost their employment. And so due to COVID, we have seen firsthand the impact that the health crisis has had on Highwood and just how important resources and services and our programs are. Our neighborhoods have been plagued with the negative effects of the economic downturn. Many families have lost employment, have lost their homes. Not that they own the homes, but renting was no longer affordable for them, and they're battling with food insecurity. On a weekly basis, the library now provides meal kits to over 220 families. And so who would have thought that a library could be a food distribution site? And so we're partnering with Kurt's Cafe and the Roberti Community House to provide meal kits to these families who otherwise would not have the ability or understand that you can come and access these free resources without fear, and that from here we can connect them to other services that the United Way 211 may be able to offer. Educating and connecting families with this vessel, with this lifeline, has been our priority. And I'll give you an example of the needs here in Highwood. I want to share another story with you. A few weeks ago, or even during the summer, there was a new family that's moved to this community. They've been here under 2 years. They don't speak the language, and it's a mom and her 3 kids. The 11-year-old would come in here during the summer, running in here without a mask and without any shoes on. And so I would ask this child, here's a mask, and but where are your shoes? And she would say, oh, I left them in the park. And so she would walk out, and then the next week would come, and again, she'd have no shoes. So finally, I sat down with her and I said, tell me what's going on with your shoes. And she said, okay, I'm gonna be honest with you. I don't have any more shoes because I outgrew my shoes. And my parents can't afford to buy me any more shoes. And my brother, who's 12, and my brother, who's 1, they don't have shoes either, and we don't have any coats. And this is the first time we're going to be here with this weather. We never knew we needed a coat. And so to respond to these needs may seem like that can't really be happening here in the North Shore, in this community, but it is happening. Poverty is real, and it's impacting the families that we work with. And so to be able to respond to this need quickly, and to be able to have, as staff members here, the ability to connect to resources and to give this mom a lifeline that she could now, call the United Way 211 without fear. And maybe they have other needs, that it's not just the shoes. And as Sam was saying, this is another story, and these are real life issues that we're seeing on a day in and day out basis. There's another mom, single mom, 2 girls. She moved here from another state, and her daughter's in her 20s, and her other daughter is 8 years old. During the year a year and a half that I've been here, I've seen this mom and this child come here every Saturday for activities and for fun. And so during COVID, I made it a point for my staff to create activity kits to send to all these families that were now stuck indoors. And so this mom was one of them. She came to pick up her little art kit for her 8-year-old. And when I saw her at the door, she just seemed depleted. And so I asked her if she was doing okay. And she broke down crying, saying that she and her daughter had lost their employment. They were the breadwinners. They were the ones that were paying rent and making ends meet. And for 2 months, they had gone without work, and they had no money, no knowledge of where to access services, and were afraid to ask for help because they had never had to ask for help in the past. And so I gave this mom the United Way 211 little insert, and I said, here, this is a connection. You can call them for financial assistance, for counseling, for food assistance, and let me know if I can help in any other way. So she left with a box of food and this United Way information. So 3 weeks later, I see her again because I hadn't seen her since. And she says to me, Carmen, do you still have food to give? I'm like, yes, we can give you all these resources. I hadn't seen you. I thought things were better. She said, actually, no. My 20-something-year-old swallowed 3 months of her heart medication because she wanted to commit suicide, because she didn't want to be a burden to me any longer. And if I had one less mouth to feed, the family would be better off. Now, how do you respond to a mom who's in this deep struggle, other than accompanying her through this process and saying, there are lifelines for you. There are resources for you that you can connect to and connect with. And so for us, having that ability to reassure
in the interest of time, I'm sorry, 1 minute, I apologize.
No problem. So all I want to say is that for the past 7 months, We have seen the need. We understand what's happening in these communities, and we know how to connect families to the resources necessary. And as staff members here, we know that we are also accompanied by services that the United Way is able to offer. So thank you for listening to these stories, but I just want you to know that these are real issues. And for all of us that are working out in this nonprofit field, we're seeing them on a daily basis.
No, I definitely enjoy the stories. They're compelling, and again, it brings that human element to what 211 actually means. The data is important, but to know how it really helps real people in the real world is huge. But we have so much more program we have to get to in a limited amount of time. So forgive me for cutting you off. I do want to make a note really quickly too. In regards to our children, we all care about the safety, security, and well-being of our children. So just as a note to our viewers and everyone else, resources can be reached at the for the Lake County Children's Advocacy Center, also through 211. So Lake County Advocacy Center is also connected through 211. They do fantastic work working with abused, neglected children. So I wanted to put that out there as well. That's a very unfortunate story. It was heartbreaking. I didn't know the library provided so many services. So I want to salute you on your multi-dimensional approach to the library that you have. Like a beacon of hope there in Highwood. So great job. My last question would be 1 minute each. And if you can do less than 1 minute, that's also appreciated. So no pressure. But my final question to the entire panel would be, what is it about 211 that makes you want to see it continue to grow and thrive into 2021 and beyond? Mr. Harris.
Well, Mark, after hearing everything that was stated today, you have a collaboration of partners, agencies, municipalities, government support, non-for-profits here talking about how 211 has aligned with their mission and vision. And just hearing the stories today and hearing how 211 has provided numerous resources and access to a lot of our community members, it clearly speaks to why we need 211 here in Lake County and why we need to continue marketing it accordingly. One thing I do want to mention is that 211 is now providing immediate access resources to our community members, especially the underserved community. I know through workforce development that one thing that we've always stated is individuals need access to resources and services. And 211 is that resource that provides immediate access to the necessary resources, especially our underserved community. Last but not least, from everything that has been stated today, 211 is saving lives. And when you're saving lives, that is enough justification to keep this thing running.
Thank you. Thank you, Mr. Harris. Brenda?
Oh yeah, I want to piggyback on a lot of that, Damar. Well said. I appreciate that. I think in addition to just reducing the barriers to service, I think that we've just seen in the last year when things change so quickly, it is extremely valuable to have a resource that's constantly updated that you can access on the website or through a free phone call or a text message quickly to get the most recent information. We just see programs reinventing themselves over and over again. Some of the stories today have talked about that. Mano a Mano's programs, the Highwood Library, and just knowing that you can always get the most recent information through 211 is a huge value to our community.
Thank you. Ms. Ortiz, 1 minute or less.
So, when I think about 211, I think about community, right? And also having a centralized hub of all of these resources, having worked at Waukegan Township in the past, sometimes we're scrambling about finding referrals for our clients. Then when I came on board to Mano a Mano, 211 was extremely helpful to our caseworkers, our social workers, because we were able to access not only our community members able to access resources, but if our caseworkers, social workers do have a question, we also as professionals rely on 211. And so it's a very, very important resource in our community. Again, the intersectionality is there, centralized services is there. And so, everyone heard today, how it impacts, almost every sector here in Lake County. And therefore, I don't have anything else to add, but just that it's critical work and very important work. And I'm very grateful to United Way, but also to those individuals, the donors that make this happen.
Awesome. Thank you. Mr. Johnson Morello.
Thanks, Mark. I think Brenda said it well. I think it's just that there's a single point of contact. We have a lot of great services available in Lake County, but even as a professional, you just cannot keep up with all of it. And so having one place to call and direct people to and know that it's updated in real time is just great.
All right. Thank you, Sam. Appreciate that. And last but not least, Ms. Patland.
Make it 30 seconds. So by providing families with support systems and services is one way that we can ease the fear and tension that especially undocumented immigrants face on a daily basis. So we as staff are here at the library able to provide this with knowing that the United Way is available. So the United Way continued growth and access is key for us. And so thank you, United Way 211, for everything you've been doing. And thank you for everyone that's listening to this panel and for all of the panelists here, because we all serve compassionately in this community. And I think that's what makes all of us great. And so thank you so much. And I hope that the United Way continues to grow. The United Way 211 system continues to grow. Thank you.
Outstanding, outstanding. Thank you. Wonderful job from the entire panel. This now concludes our panel, the panel portion of the program. I would like to thank all of you for your time, for your insights, for your passion of what you do, and sharing that collaboration with 211. So everyone on the panel, thank you. And I'm sure I'll be talking to you all each offline, individually, professionally. So great seeing all of you. Thank you. Thank you for your time. Okay. We'd like to wrap up our program now with a real gift. We would like for you to hear from Kelly Brown, who is director of the 211 Contact Center, the place where everything we've heard about today really happens. Without further ado, Kelly.
Hi, everyone. I'd like to share some of what goes on behind the scenes at 211 in the Contact Center. Our 46 full-time navigators started off the year working together in a central office. But since this past March, like most of us, they've been working from home. Where a supervisor or a team lead used to walk the floor ready to answer questions and support on a crisis call, we now have the Contact Center group chat on Teams. Supervisors and staff are chatting together 24 hours a day about client needs, asking for help, finding resources, and providing a connection to each other and a sense of community. Specialists field 20 to 40 contacts every shift, taking calls and two-way texts. It takes about 20 minutes to complete the average contact, but some have taken up to 4 hours over several days when the situations are really complex. Navigators cover 2 to 3 different need categories on every call too. So they really need to have a social service programs knowledge that just goes across a large spectrum. A conversation that starts as a request for how to apply for SNAP benefits may have red flags in the conversation that hint at trouble with family violence and also with depression, things that need immediate intervention. Calling 211 creates an opportunity to get resources for your primary need and also the unstated needs that sometimes are even a greater issue. I've been really proud of our team this year. And not only have they delivered excellent service in the first year of Lake County's 211 program, they've had to do that during a national pandemic. They listened to and took care of Lake County neighbors struggling with the consequences of COVID-19, while of course struggling with it themselves in their own lives, as we all have. The 211 database is really robust, and really thanks in part to the constant info updates those of you in health and human services agencies on this program are providing to us. Since the beginning of the COVID-19 response, we've had several additional training sessions to make sure that the navigators had the absolute most current resources at their fingertips. I love it when one of the navigators is expressing in our chats that they just connected a person in need to the exact right resource. It's truly a daily reminder that what we do matters. And it has kept us all going when things got really tough in the spring and summer. We expect a busy fall and winter too, though. And I know that you all are expecting the same. You can expect the same high quality of service that we've been delivering so far. We're gearing up with extra support for our navigators so that they can in turn support the whole Lake County community. It is a complex and sophisticated operation that makes 211 run well 24/7, but deep down, I also think there's just a little bit of magic. The magic that happens when a lot of good people are working together to accomplish great things. That is what is happening here. And I'm proud to be part of it as your 211 Contact Center Director. Thank you for your time and thank you for having me.
Thank you, Kelly. And thank you for sharing with us a peek behind the curtain of how the magic of 211 actually happens. It doesn't just materialize. There's many, many people and many moving parts that come together to see this succeed. So as promised, this program is 1 to 2:30 and we are right on schedule. I hope this last hour and a half has been insightful. It's been provided information, maybe some resources, and told you some things maybe that you didn't know about 211 and all the great work going on right here in Lake County. So Kelly, again, thank you to everyone, and I do mean everyone. Every one of you who works in human services and work in agencies that are connected to 211 to serve our community. Please be sure to keep your information at each of your respective services up to date and current. And if your group needs training from the United Way staff or needs a refresher on the functionality of 211, please let us know. Thank you to every one of you who has spread the word about 211, made it come to life, and have allowed 211 to positively impact the lives of so many people in need. Look at the results in just 1 year. Imagine how many more people we will help as we will all continue to promote the great services of 211. Please, with your word of mouth, continue to promote 211. And if you need materials to post at your different agencies on the wall, some pamphlets, so people are aware of 211 and how to get the word out, feel free to let us know. We'll get you some information. And of course, a huge thank you to every one of you who has supported 211. Your support built the program, and it's what will sustain it. From a financial perspective, we encourage you to join the 211 Club that Christy alluded to earlier in the program, if you haven't already. And if you're a bigger business and can start sponsoring or renew your sponsorship to 211, that would also be extremely valuable to continue the great work being done by the 211 program. As we've seen today, 211, we must keep it going. It's making a real difference here in Lake County. As Andrew Carnegie once stated, teamwork is the ability to work together towards a common goal, the ability to direct individual accomplishments toward organizational objectives. It is the fuel that allows common people to attain uncommon results. Thank you for joining us, everyone. Have a great day, and we'll see you next year.